I'm Antoni Chan, consultant rheumatologist in the London, United Kingdom, and I'm reporting here for Room Now at ACR 22 in Philadelphia. In the area of axial spondyloarthritis, there are many comorbidities as well as extra-articular manifestations that may go along with the condition. This can have an impact on the quality of life as well as long-term outcomes in our patients. And there is an interesting abstract, number 1609, which looks at comorbidities in patients with ankylosing spondylitis, because this is important in terms of understanding the disease activity and also the functional impairment. This is data from the SOAS cohort, where they had patients with ankylosing spondylitis and also documented comorbidities and extra-articular manifestations. What they did was to link the comorbidities. So many of these comorbidities are linked between one to the other. And from this linkage study, they were able to develop some clusters of comorbidities. The patients were reviewed at baseline and then followed up every 2 years in this cohort. In average, there was a 2.9-year follow-up of over 1,270 ankylosing spondylitis patients. The results from this study showed that depression was the highest comorbidity at 33%, followed by hypertension at 28%. In terms of extra-articular or extra-musculoskeletal manifestations, uveitis was highest at 34% in the ankylosing spondylitis group. When they pulled the data together, they were able to develop 5 clusters, and the clusters were the depression cluster, no comorbidities, hypertension, uveitis, and miscellaneous comorbidities. In the patients group with no comorbidities in this cluster, these tended to be patients who were younger and also shorter disease duration, and the percentage of female patients here were 20%. In the depression cluster, on the other hand, these patients had more comorbidities, worse disease activity, and also poorer functional status. So this is quite important in terms of how we manage our patients, in terms of knowing the impact of the comorbidities and also the extra-articular manifestations on the presentation and also management of our patients with ankylosing spondylitis. So to conclude, this study shows that depression or the depression cluster predicted the worst outcome in terms of disease activity. They had high disease activity, and also they had reduced functional status. So I think this is again an important study, how we manage our patients, that we will not be only be treating their objective clinical signs that we see, but also managing their comorbidities to ensure that we get the best outcome for our patients. I'm Antoni Chan, reporting here at ACR 22 in Philadelphia. You can follow me on Twitter at Synoville Joints.